gynecologist referred me to Dr. Eisenberg because there was a third option that she could not give me, and that was the robotic hysterectomy. I was hesitant about doing it because I was loyal to her and he was a stranger, but I really liked him from the start. I never felt like he was in a hurry to get to his next patient, and he answered all my questions.
My thoughts were I would have a big scar, I'd be cut open, and the recovery would be like 6 to 8 weeks, and I wouldn't be able to do anything. And then Dr. Eisenberg had told me that no, we actually do it laparoscopically now. You're going to be out for just a couple of weeks, and you'll be back to normal functioning, and it's exactly how it's been.
A very large fibroid tumor, and it was the size of a 20-week pregnancy. At the time, I didn't know it was that large, but it was sticking out very large. And I went to one other doctor, and I didn't want to be cut because of my job. I have to stand on my feet. I'm a hairstylist. Plus, I couldn't, have that long recovery time. So I found Dr. Eisenberg through a friend of mine, and she had had the same procedure done and was also told that, it couldn't be done laparoscopically. So anyway, I met with Dr. Eisenberg, and he checked me out, and he felt very confident that it could be done through the Da Vinci robotic method, and I explained to him.
My gynecologist, who referred me to Dr. Eisenberg, had told me the abdominal hysterectomy would probably take 6 to 8 weeks of recovery, and I didn't have that kind of time.
I did the surgery, everything went well. I know everybody is different, but I didn't have any complications. I didn't have any gas. I just recovered very quickly. He told me that the recovery time would be 1 week, and I had my surgery on a Tuesday, and I kind of tested the waters. I went to work on that Saturday and did a couple of clients, and I did fine. I was just moving, I guess, a little slower because of, the anesthesia was probably still in my system. But I was back to work in a week, and everything is fine.
It was incredible. I call it my drive-through hysterectomy. I was in and out in no time.
I was back to work, back to my normal, doing everything. I couldn't lift, obviously, but other than that, I was back to work and driving. And
after my surgery, my recovery was probably a day. I spent one day lying around the house, and then after that, I was back to my daily activities. We were really busy, and I was able to get up and get around and do things. A big surprise was that there was no pain afterwards. I expected something. I was armed with my painkillers, and that was a big surprise. I had nothing from the incisions, and nothing kept me down.
First couple of days were probably like an 8 to a 10 on their happy or sad face level, but the next week was like a 1 or a 2 level. Not bad at all.
What I appreciated was the fact that I had very minimal pain. I had a prescription for the good stuff, but I never really had to use it. I was just taking Motrin, and I really didn't even need that a whole lot. The most I had was soreness, and then that went away, and everything is fine, and it's like
next day I slept a lot. I didn't do too much, not in very much pain in the pelvic area. I had a lot of pain from the gases that I had put inside of me. Other than that, just slept a lot.
He's very nice. I like him a lot, and he's always concerned and asks me, he'll sit. The thing that I like about him is he will listen to whatever my concerns are, and then we have our little discussion, and then he moves right along, and he also projects in the future like what we need to do so that we can go ahead and get it scheduled. So he's always thinking ahead, so I like that.
He described everything to me. He told me they were going in laparoscopically. I'd have 4 little incisions. He told me exactly everything that would happen. He explained everything thoroughly, and everything went as well as expected.